Welcome to the Life Cycle Physiotherapy presentation on Diastasis rectus abdominis muscles in pregnancy and postpartum. So what might you want to know about Diastasis rectus abdominis? Well, you might like to know what it is first of all. Also, when you do have a separation, how much is too much? So how big a separation is significant? And why is it a problem for some women? What can you then do about it if you have this in pregnancy, and also what can you do about it after you've had your baby? So let's look first of all about what a diastasis rectus abdominis is. It's also called mummy tummy or abdominal separation or just tummy separation. So you may see it called different things. But basically what we can see here in the picture is just around the woman's belly button area. You can see there's some loose skin, and either side of that there are little bulges, and those bulges are actually where her muscles are, but in between that there is not actually good muscular connection in there. So that little gap between her muscles there is what we'd be looking at with the diastasis, and we'll look at that in some anatomy pictures in a bit more detail in a moment. So to understand diastasis, we actually need to understand what normal anatomy is of that abdominal region. So this picture shows some normal abdominal anatomy. There are actually 4 layers of abdominal muscles, and the ones we're seeing mainly here, the red muscles we're seeing in the middle on either side here, are the rectus abdominis muscles. Those muscles are the most superficial, the closest to the surface of all the 4 layers of abdominal muscles. Deep to that we have 2 layers of oblique muscles, and they crisscross each other. And then deepest to that is a muscle called transverse abdominis, which is the one that people often refer to when they're talking about your core muscles. Now, the abdominal muscles are actually joined by a whole network of tissue called connective tissue or fascia, and that actually threads between all the layers of abdominal muscles. But the area of fascia we want to concentrate most on here is an area called the linea alba. Now that's actually marked on that diagram, but you can see it as the line that goes straight down the middle of the, in between the rectus abdominis muscles, and actually goes around the belly button as well. Linea alba literally means white line, and it is that line of connective tissue straight down the centre. Now that actually connects the rectus abdominis bellies in the centre. So the rectus abdominis muscles don't typically sit directly next to each other. They often have that little gap, and the linea alba is filling that gap. And in fact, when they have looked at studies looking at the average width of the linea alba, or the space between the rectus abdominis muscles, they find that it's not actually 0. On average, it's around about 16 millimetres at 2 centimetres above your belly button, but it can be up to about 22 millimetres on average. And that was a study that was looking at 150 women who'd never had a baby. That study was done in 2009 and showed those markers, and those kind of results have been repeated in other studies as well. So average, we're talking around about 1.5 centimetres up to just over 2 centimetres is a normal width in women who've never even had a baby. So you can see also in that picture the linea alba is naturally wider in some parts than in others. So it does have to widen to go around the belly button or the umbilicus. And then in other areas, like up the very top of the abdominal muscles and right down low, it also tends to be naturally a bit narrower. So depending on where you measure it, you're going to find a different width of that linea alba as well. So remember, this is normal abdominal anatomy and typically what we'd see in a woman who's never been pregnant before and never had a baby. Now, with diastasis rectus abdominis, what we're looking at now is a widening of that space between those superficial muscles, the rectus abdominis muscles. That space has become wider apart. And you can see that comparing the diagram on the left to the diagram on the right. So, of course, when a woman gets pregnant, there has to be some widening of and stretching of the abdominal muscles to make room for the baby. But with that, the connective tissue also stretches. So all that fascial tissue has to stretch out as well to make room for the growing baby. And that's a pretty normal thing to happen because you have to make some space in there. So what we can see is that typically the muscles themselves stretch out and the fascia stretches. And so what we're talking about with a typical diastasis is it's just that widening and stretching of the tissue. The tissue hasn't torn, so there's not an actual gap there, but the space between where the muscle bellies sit has become wider, with the connective tissue still being intact but just stretched out. In some cases, we will see that there's been a connective tissue tear and a woman may get a hernia, but it's not the normal scenario. Normally, it's just that widening and stretching of the tissue rather than it being an actual true separation. And so the name abdominal separation does make it sound a little scarier than it really actually is. What some women will notice when that happens is that when they do certain things like sitting straight up out of bed, for example, or getting out of a chair or lifting things or even bending over, that they get a bit of a bulging or a bit of a dome shape in the middle of their abdomen. And that's because without the further layers of abdominals being closer together there, and there's only a layer of stretched out connective tissue, that when they do those things, there's not good support in the front of their abdominal wall. And so some of the inner contents are basically pushing out through the gap, and that's what's creating that doming or bulging. Now, in terms of prevalence, the studies vary a lot on this actually, but typically they'll show somewhere between about 60 to 100% of women will have some degree of diastasis by 36 to 38 weeks of pregnancy. So it can be up to all pregnant women show some diastasis. And then in terms of what happens after the woman's had a baby, we know, look, when tissues have stretched, it's going to take them time to recover. That's pretty normal. A lot of studies talk about 8 weeks being typical, but we can see in some studies that it can take months for this to recover. And that can be variable, how much have the muscles and the tissues separated in the first place and stretched out. And that can be things like how big was the woman in the first place, what was the size of her baby, was she carrying twins, those kind of things. And also some people have connective tissue that stretches out well and just bounces back quite nicely. And some people just genetically have connective tissue that once it stretches, it doesn't come back together particularly well. So all of those variables can make a difference as to how long it can take to recover from pregnancy in terms of the diastasis, and also what degree of diastasis you're going to see from woman to woman. So how much of a separation or widening between those muscles is actually too much? There's actually quite a variation of how studies define what is too big or what is an actual significant diastasis, and that makes it really confusing. So some studies will talk about 2 to 3 finger widths being a significant diastasis, but how wide is everybody's fingers? My fingers are going to be different in width to your fingers, and they're going to be different in width to somebody else's fingers, so it's not a particularly accurate way to measure it. A lot of the studies these days are using calipers or an ultrasound measurement, much more reliable, and they will again vary as to how they define it. So some are saying anything wider than 1.5 centimetres is considered a diastasis. Remembering that normal anatomy study though, that normal could be up to just over 2 centimetres. So interesting that that's how some define it. Some are saying more than 3 centimetres wide, and there's everything in between as well. And then the studies vary a lot as to where they measure it. Remember we saw before on that linear alba that actually the width of it varies quite a lot along its length. So some of the studies will vary in where they measure it. Some will measure at the level of the belly button, and then they'll often measure above or below the belly button, and how far above or below will really vary a lot as well. So it's really common to see a lot of the studies measuring at about 2 centimetres above or below the belly button, but some can be up to 4.5 centimetres above and below. So obviously, depending on where they measure it, they're going to get quite different measurements as well. So that can explain why we see such a big discrepancy in some of the prevalence rates reported in studies, because it really depends on how they define what is significant and where they actually do the measurements as well, and how they do the measurement. So as I mentioned before, between 60 to 100% of women will show a diastasis by that late stage of pregnancy, so 36 to 38 week mark. By about 6 weeks, we're still seeing about just over half of women, so about 52 to up to 60% of women still having a diastasis by 6 weeks. And then, as I mentioned before, it can take months to recover. So some studies show 35 to 46% of women still have some diastasis by 6 months as well. So for some women, it can take a lot longer to recover. So we're still not entirely sure, are we, on how much is too much for that diastasis. One thing to remember is that all of the previous studies had been measuring diastasis as an average measurement in women who had never had a baby or in fact had never been pregnant. So remembering that it's normal to have some separation before pregnancy, and we know that, of course, those muscles in the connective tissue have to stretch and widen during the course of pregnancy. So it's quite possible that maybe we're overdiagnosing it, because if we're saying that up to 100% of women have a diastasis by the end of pregnancy, does that mean that all women are abnormal in pregnancy and that a large percentage of women are abnormal in the postpartum period? So there must be some sort of normal variation amongst women who have been pregnant and postpartum in terms of how big the diastasis is. We can't classify that entire group as abnormal because, obviously if everybody's abnormal, then there's, what is normal? Luckily, back in 2018, there was finally a study that looked at women who were pregnant and also postpartum, and they looked at 84 women who were first-time mums. They measured them in late pregnancy. I think it was around 36 to 38 weeks. And then they measured them in the postpartum period at about 6 to 8 weeks, 3 months postpartum and 6 months postpartum. And what they looked at was the widest point at 2 centimetres above the umbilicus. And they also looked at they measured out the umbilicus as well and 2 centimetres below. But they found the widest point was 2 centimetres above the umbilicus. And then they gave a lot of normal ranges for those measurements. They defined normal as being anywhere between the 20th and 80th centile. So if women were below that 20th percentile, then they said that they were, that lower end and weren't in the normal range. If they were above the 80th, and again, they were in that abnormal range, but they took that middle 60% as being normal. And the figures I'll quote you here in brackets, the bracketed figure is that dead middle 50th percentile. So what they found was that in late pregnancy, it was normal to have a widening between 54 and 86 millimetres of the diastasis, with the middle range being 64 millimetres. So anywhere between about 5.5 and 8.5 centimetres was actually normal, with the average being about 6.5. Not surprising when you consider what those muscles and tissue have to do in the course of pregnancy. By 6 months postpartum, the normal range was between 17 and 28 millimetres, with the average being about 22 millimetres. Now remember that previous figure of normal range previously in women who'd never had a baby, with the mid-range being about 16 millimetres, but went up to about 22 millimetres. So we're actually getting back into that kind of range by 6 months postpartum, but with that average being slightly higher than what it was in women who'd never had a baby. Why are people concerned about diastasis? Why is it a problem? Well, just subjectively, many women report that they feel weaker or less supported in their tummy and their backs when they have that separation. And we'll talk about that a bit more in a minute, because that's not necessarily just related to the diastasis. A lot of the time, women don't like how it looks, so they really don't like that cosmetic appearance of their tummy, and particularly they hate it when people still think they're pregnant. So when they have people just coming up to them and asking them when they're due, and they had their baby 3 months or 6 months or 1 or 2 years ago, it can be quite embarrassing for them when people are saying, "Oh, when are you due?" because they still think they're pregnant. The other thing that we need to be aware of is that there's been a lot of social media campaigning in the last couple of years, targeting women in pregnancy and in that postpartum period who have a diastasis, and making claims that if you're pregnant and you have a diastasis, then you're going to not be able to have a normal delivery, you're going to be more likely to have a cesarean, more likely to have back pain, and then also claiming that if you have an ongoing diastasis once you've had your baby, then you're going to be more likely to have back and pelvic pain again, you're going to be more likely to have pelvic floor problems, and making those kind of claims. And often, unfortunately, these same groups are then saying to women, well, if you want to fix that and make sure you don't have these problems, then you're going to have to come to us and spend loads of money to get better, and we're an abdominal support 23 hours a day and things like that. What does the evidence actually show though? And what the evidence shows is that there is actually no significant association between a diastasis and low back or pelvic pain. So a number of studies have looked at this, and they have shown that you can actually have low back or pelvic pain just as likely if you have a diastasis or if you don't. So yes, women are still going to get some low back or pelvic pain, but it doesn't have any relationship to whether they have a diastasis. There's also no association between a diastasis and pelvic floor dysfunction. There have been a couple of studies on this. Their overall conclusions is that there's no link at all, although one of the studies did show that actually in some cases there was a slightly greater chance of having some pelvic floor dysfunction if you didn't have a diastasis. So you were less likely to have it if you did have a diastasis. But overall, there seems to be no significant association between that diastasis and pelvic floor dysfunction. Also, there has been absolutely nothing to show that having a diastasis changes your birth outcome. So it doesn't make you more likely to have a cesarean or to have a difficult vaginal delivery or need an episiotomy or anything like that. So those claims are completely unsubstantiated. And also you can function perfectly well with a diastasis. So that idea that if I have this then my abdominal muscles feel weaker or less supported, well, you can actually learn to support that abdominal area well, even if you have a tummy separation. As a good example, there's a women's health physio in Adelaide who I know who still has a reasonably significant separation, which she can demonstrate when she has to concentrate hard on it. And she's got probably somewhere between a 7 to 10 centimetre separation of her abdominal muscle still after having 3 children. It does not affect her function. So she can exercise normally. She's a keen runner. She has run several marathons, multiple half marathons, all in very good times. She's a fit and active woman. She doesn't have issues with her abdominal strength because of her diastasis. So it's not necessarily the reason for having less core support or feeling weaker, and you can actually still strengthen the abdominal muscles and learn how to support that abdominal wall well, even with a diastasis. So if you do have this diastasis, what can you do about it if you're pregnant? Now, what this picture shows quite nicely is that doming effect that I mentioned earlier. So the picture on the left is just showing a pregnant belly, and on the right, that woman's probably doing a little head lift off the bed there, and you can see that funny bulging or doming shape right down the middle of her tummy. And that is that doming or party trick that some women with a diastasis can do. Now, ideally, we don't really want to be creating that doming all the time, because you can imagine if you're doing that quite frequently, you're actually stretching muscles and tissue that are already stretched and encouraging more of that stretching and bulging there. So we want to be able to control that as much as possible. So there have been a few studies that have suggested that doing exercise in pregnancy can decrease the diastasis of the rectus abdominis muscles during pregnancy and postpartum. The studies do vary a bit, but there are some studies that suggest that it can be helpful if you're doing pregnancy exercise, that maybe you have less of a diastasis also after you've had your baby as well. Certainly, just being careful with the way you do things can make a difference. So learning how to actually get out of bed or get out of a deep chair without creating that doming can be one really helpful thing to do. learning how to lift so you've got good support there as well. So, and that's something a women's health physio can teach you is, how to do these things without creating that bulging and doming so you're not continually stretching those already stretched tissues. Some women find support garments can be helpful. Just simple tubie grip can work really well for a number of women. You can certainly get more expensive pregnancy support. So there are things like some of the pregnancy shorts and garments some of them do have a belly band that goes over the belly. You can get various belly bands even from Target and Kmart these days as well. There's not a great deal of evidence to show that they will change whether or not you have a diastasis, but certainly they give a bit of feedback to help support the belly, and a number of women find that they do feel really comfortable and supportive as well. And just having some education about that diastasis and the fact that it's actually not a major problem. It's not going to cause your back pain. You can learn how to support it and manage it well. It can be really reassuring for a lot of women, because I see women who are very worried about it and think it's going to be a big problem, and they can be reassured that actually that's not the case. So in conclusion, diastasis of the rectus abdominis muscles is common and it's normal in pregnancy. It's not actually a pathological problem, so it's not something you have to be really concerned about, but it doesn't mean, you certainly can go and ask somebody for an opinion, but don't think you need to, sign up to wearing an abdominal binder for 23 and a half hours a day and doing weeks and weeks and weeks of classes to get rid of it. It does take time for muscles to recover from being stretched out during pregnancy. That's really normal, but you can do things to help that, like looking after your posture, exercising appropriately during and after pregnancy, and just making sure that you're not doing things to put more stretch on those muscles.